Welcome to Vision Hub. Today we're going to be looking at the topic psychopathology and phobias. AQA AS psychology. So what are phobias? Phobias are excessive fear and anxiety caused as a result of object, situation, or place. There's 5 classified phobias into 3 types. So we have specific phobias. This can be a phobia of an object, for example, a spider, or a situation, for example, flying. So obviously flying while traveling. And then we have social phobias. This is a phobia of social situations, for example, public speaking. And then we have agoraphobia, which is the phobia of being outdoors or in public places. So obviously you stop leaving the house to go anywhere. So you stay in the constraints of your home. Characteristics of phobias. Behavioural characteristics. Panic when the phobia is present. Avoidance is shown because you want to make every effort not to come into contact with the phobic stimulus, and this does make daily life difficult. Endurance is the opposite of avoidance, so you stay where sometimes you may want to stay where the phobic stimulus is, even though this causes you high levels of anxiety. Emotional characteristics. Anxiety and fear in response to the phobic stimulus. Anxiety is an unpleasant state of high arousal and makes relaxation or experiencing any other positive emotion very difficult. Fear is also unpleasant and is experienced when you are in the presence or even thinking about the phobic stimulus. Cognitive characteristics are that once the phobic stimulus is seen, it is difficult for you to look away from it. So you keep your attention fixed on something really dangerous, which is beneficial because it gives you the best chance to react quickly, but this is not the case when fear is irrational. And irrational beliefs about the phobic stimulus are normally present. For example, if you have a social phobia, you may feel like you have to sound intelligent throughout, say, your public speech if you're doing that, and this increases pressure to perform well in social situations. There's also cognitive distortions, which are the perceptions about the phobic stimulus you have. So they're biased. For example, a spider is dangerous and will pose harm to me, but others may not believe that this is the case. So you have a set thinking method about your phobia. Explaining phobias. So the behavioural approach. Mora 1947 came up with a 2-process model. So this was based around the idea that phobias are learnt via classical conditioning and are maintained as a result of operant conditioning. So classical conditioning is learning via association. So Watson and Rayner in 1920 did a study on an infant called Little Albert. And to begin with, Little Albert didn't have a phobia, and so the purpose of the experiment was to give him a phobia. So each time a rat was presented in front of Little Albert, an iron bar was banged in his ears. This resulted in fear, and this experience actually resulted in Little Albert developing a phobia for anything that was white and furry. A phobia is then maintained as a result of operant conditioning, and operant conditioning is learning via rewards and punishment. The behavior is most likely to be reinforced if it is rewarded, so you're more likely to repeat the behavior if it's rewarded. In the case of a phobia, Mora said that you avoid the phobic stimulus in order to escape the fear and anxiety, and this reduces this urge to reduce your fear reinforces avoidance behavior, so the phobia remains. Evaluation of the Twoway process model by Mora is that it has good explanatory power because it explains how phobias are maintained and emphasizes that the patients need to be exposed to their phobic stimulus in order to cause them anxiety and fear in therapy, for them to be able to deal with it when they're outside of therapy. So this increases external validity. However, a weakness is that not all of the avoidance behavior displayed is caused as a result of anxiety reduction, because there is evidence to suggest that some of the avoidance behavior is due to positive feelings of safety. This implies why, according to Buck in 2010, those with agoraphobia cannot leave the house by themselves, but they can do with a trusted person. This has not been accounted for. This has not been accounted for in the two-process model, which decreases its reliability. Another weakness is that the two-process model does not totally explain phobias, because Bounton in 2007 suggested that evolutionary factors could play a role in phobias, but this is not included. This once again questions the reliability and generalizability of the model. Treating phobias. So one of the behavioural approaches to treating phobias is systematic desensitization. So this teaches you a new association, so we link back to classical conditioning. To begin with, the client creates a note. I'm referring to the individual with the phobia as a client and not a patient, because they're referred to as a client. So to begin with, the client creates a hierarchy starting with the least anxiety causing situation involving their phobic stimulus and building this up to their most anxious situation with their phobic stimulus. For example, if I had a phobia of, say, spiders, my least anxiety causing situation would maybe be looking at a picture of a spider, and my most anxious situation would be touching a real life or more like living spider. So before the client works their way up this hierarchy, the therapist teaches them breathing and muscular relaxation techniques that they will use once they're confronted with their phobic stimulus. So you would probably understand breathing techniques, inhaling, exhaling, and muscular relaxation is when you tense certain muscles in your body and then relax them. And according to reciprocal inhibition, you cannot feel anxious and relaxed at the same time. This process means that a new response to the phobic stimulus is learnt because you feel relaxed instead of anxious, and this is called counter-conditioning. Now we're going to evaluate this the therapy of systematic desensitization. A strength is that the treatment of specific phobias is effective because Gilroy et al. In 2002 had 42 patients who were treated for a phobia of spiders in 3 45-minute sessions of systematic desensitization, and there was also a control group who was just treated with relaxation and no exposure to the spiders. It was found that after 3 months and even after 33 months, the systematic desensitization group feared their phobic stimulus less than the control group. This suggests that the effects of therapy are long-lasting, increasing its reliability. Another strength is that systematic desensitization is suited for a diverse range of patients, for example, those who have learning difficulties. This is because it is a gradual process that has stages, increasing its generalizability to everyone. However, a weakness is that it can be time-consuming because you have to attend a lot of sessions with the therapist, which may mean that you do not remain consistent with attending them, since it's difficult to do so in daily life, which obviously then decreases the effectiveness of the treatment. The second way that can be used to treat phobias is flooding, and this is where you don't have a hierarchy. The client is exposed to the highest anxiety-causing situation with their phobic stimulus. So in this way, the response of anxiety towards the phobic stimulus is stopped very quickly, and avoidance behavior is not really an option. You quickly learn that the phobic stimulus is harmless. All of this takes place in a process, part of classical conditioning, called extinction, where the conditioned stimulus is met without the conditioned response, so the conditioned stimulus no longer results in the conditioned response. Longer sessions are required, but fewer of these sessions are required. We're now going to evaluate flooding. So the strengths are: to begin with, it's cost effective in comparison to other cognitive therapies, and it can be more effective than other alternatives. This is useful because the patient is free from their phobia quicker, making treatment cheaper. Another strength is the sessions needed for this treatment option are longer, but fewer are required, which could mean that you have to dedicate a set number of hours, or you need a set number of sessions in order to get rid of the fear and anxiety you have from caused as a result of your phobic stimulus, which makes it easier to accommodate for these sessions into your daily life. However, a weakness is that it's not as effective for certain phobias, for example, complex phobias like social phobia, because cognitive therapies will be needed in order to help manage irrational thinking. And this reduces the generalizability of flooding to treating all phobias. Another weakness is that the experience can be traumatic and unpleasant for the client, which may mean that they don't want to complete their treatment. So in this way, time and money is wasted, which isn't really, it isn't really worth it then. In our next video, we will look at depression, but before then, make sure you made your notes on what we've covered so far. Remember to revise, rest, test and repeat yourself. Don't forget to follow us on Instagram. Thank you to Canva because I made these slides using their templates. And don't forget to like, subscribe, comment, press the bell icon on our channel, Revision Hub. Thank you so much.